Thank you, guys. So welcome to today's open day webinar for the sport rehabilitation program. So a little bit about the program. If you're not overly aware, we were one of the first programs, or we were the first program of our sort in the country going back some time ago now. Our friends at Salford University will probably claim that they're the first, but we were in fact the first. And essentially the program is centered around rehabilitation of musculoskeletal injuries. So in the current climate research-wise, we're well placed. A lot of evidence-based best practice is centered around exercise being very important in terms of managing musculoskeletal pain and injuries, pain in generally, and obviously on a wider societal basis, kind of city. So a lot of the current research heavily supports what we're doing, and sport rehab is still the only program on offer in the country that is a bespoke degree that specializes in exercise prescription, and marrying that up with pathology and the clinical side of things puts us in a really good place to help people with musculoskeletal pain and injuries. So this is just an aerial view of our beautiful campus. So for those of you who may not have visited the campus or looked at much of the online material, this is where St. Mary's is situated. I hope you can see my cursor. But as far as the campus goes, this is where the rehab department is based in what is known as the R block. And we spend a fair bit of time split between being on site at St. Mary's on the campus and an off-site facility that's 10 minutes at the outmost walk away from campus. So dependent on what modules are being sat at the time, we have facilities that cater best for the nature of what is being taught. So on site we have obviously the athletics track that you can see, lots of field space for outdoor sort of taught sessions. On site we have this centre here, which is, sorry, over here is what is known as the Performance Education Centre, which is a huge indoor gym sort of training facility where a lot of the sort of late stage rehabilitation is taught from, and where the biomechanics laboratory based sessions are largely run from. And then up the road at 60 Waldegrave Road, we have really big classroom facilities with plinths that are ideally suited for doing sort of soft tissue treatments, manual therapy, clinical assessment. So that's where a lot of that sort of activity goes on. I would say at level 4, you probably spend more time up the road, but still spend a fair amount of time on site for the sessions that are most pertinent for that. On the wider scheme, you can see where St. Mary's lies in the local area. So we're very well situated for both train and road travel whilst you're at St. Mary's. There's a large amount of things that you can do on your doorstep. Obviously, we're not too far away from Heathrow Airport, so for international students or students enjoying travel, that can be desirable. We're also in very close proximity to London. We're 5 minutes walk from Strawberry Hill train station with easy routes into London, so you can explore all the cultural things in London, and obviously for nights out. This also serves us well from a clinical placement perspective. There's a lot of activity that goes on sport-wise in and around London. So those transport links are really important for our students in order to be able to take advantage of the clinical placements that we have on offer. So a little bit about me, don't let the picture put you off. I started my journey at St Mary's in 1998. So I'm a graduate sport rehabilitator myself, having gone through my training at St Mary's. Shortly after graduating from St Mary's, I was fortunate enough to be given a job at that time working at the on-site clinic. I was at the time a semi-professional rugby player, so I was playing rugby part-time and working in the clinic, and I cut my teeth essentially on middle and long distance runners who were based in the area with various agents bringing over international middle and long distance runners, and was there to provide a service for the Endurance Performance Centre on site at the time. I then moved on, having finished playing rugby, to working in clinic alongside taking up a role within a semi-professional rugby club that then grew into a full-time role working at a championship rugby club as the club progressed through the leagues, and I spent a good number of years in full-time rugby for my sins. With a little one coming along, I delved into teaching at St Mary's to try and address a work-life balance and have a little bit more of a sociable working pattern. And I guess my passion for teaching grew from then. So over a period of years, I reduced my time commitment in rugby and increased my time commitment in teaching, until we sort of ended up over the last few years where I've been teaching essentially full time. I have still got a passion for rugby, so I still provide sort of consultancy services for various rugby clubs and teams, and I'm still sort of actively working in private practice, because I believe that if you're going to teach it, you need to be doing it as well, otherwise you're a bit of a fraud. Most of the teaching team you will find are either very experienced in their respective fields as clinicians, and a large number of the teaching team maintain sort of clinical practice. So we like to do as well as we like to teach about it. I think we're very lucky to have a large multidisciplinary team of lecturers on the team currently, with a huge wealth of experience between them, but people coming from multiple different clinical arenas and backgrounds really, which I think feeds very well into the program that we deliver, to give you guys a balanced perspective of things really, and with very real current first-hand experience of clinic, which I think is invaluable. About the course, so from a content perspective, for those of you who may not have exhausted the website and what is on offer there, we generally run the program in what I would think of as a layered fashion. So you start off at level 4, where we lay the foundations with what is integral to building your clinical kind of mileage on, and at each successive level we just expand on that a little bit more. So St Mary's runs a semester system, so we do 2 semesters rather than 3 terms like some institutions would. And at level 4 you have 2 kind of styles at which your modules run. So there are 2 modules that run long and thin, so they run throughout the duration of the whole year, but you only have a lecture a week, say, for those modules. And then there are 2 or 3 other modules that what we would think of as run short and fat. So they run over 6 weeks, and then you are assessed for those modules, and those modules are done and dusted for the year. So at level 4, largely your foundations are based around those long and thin modules, which are in anatomy, human anatomy, and clinical assessment. And those are the cornerstones of a clinical encounter. Your anatomy is very important. If you understand your anatomy and you know the structures and function of the anatomy, then it makes assessing someone really a lot easier in terms of getting to the bottom of what's going on. And that really, those sort of core competencies are integral to anything you do in clinics. So that's why they're long and thin, and so much time is spent on that at level 4, laying the foundations for what is to come. So there are 4 key strands that run throughout the program that are embedded into the degree program, and those are assessment, treatment modalities, exercise, rehabilitation, and research. So what you'll find if you look at the program, you'll see at each level you will have those strands in there, and we don't tend to break things up like we used to into the lower limb, the upper limb, or the trunk. When it comes to expanding on your foundations, we refer to things as patient management 1, 2, and 3, or rehabilitation 1, 2, and 3. We do teach that by limb, but the idea is that for each successive level you progress through, that rather than just looking at it as a lower limb or an upper limb, we expand on the levels of complexity at which you look at things, and the treatment techniques, etc., that would be appropriate for those body parts or joint areas. And accordingly, that means that even at level 4, we're looking at introducing research methods, we're introducing treatment techniques like soft tissue work, taping, and some sort of exercise prescription that comes within the exercise physiology module. So it's far removed from my time when your first year was just spent on pure dry theory. You do get an impression of what it's like to have some clinical competencies within that. And at the end of your first year, based on successfully completing the soft tissue component, our professional accrediting body, BASRATs, or the British Association of Sports Rehabilitators and Trainers, will allow you to join as a student member and provide professional indemnity insurance for you to be able to practice as a soft tissue therapist. So lots of our students take advantage of this in order to give themselves an opportunity to earn some money, perhaps over the summer, but also start to network already, put themselves about, build up some clinical mileage, and make some connections that can help them later on down the line with regards to placements and potentially work opportunities. Again, the research strand, lots of people often find the idea of research or doing a dissertation somewhat daunting, and this is reflected in this being a core strand. So we introduce the fundamental basics of reading, reviewing literature, and build that up. So there's a strand, that strand runs throughout all 3 years of the program. So when you layer up on that, by the time you get to your final year, where you have to produce an independent project, you've required the appropriate skills at each of the levels. So by that stage, you should be in a good place to have an inquiring mind, to come up with a relevant question, and have the skills to be able to conduct a project in an appropriate design to answer that question. From a research perspective, the university are very well equipped with technology within the laboratories and know-withal for students to be able to conduct a wide range of research interests. So essentially your final year research project could be on just about anything that fits within the remit of sport rehabilitation. So whether that's on a performance basis, on an epidemiological basis, whether you're making an experimental intervention to see what happens, whether you're doing systematic reviews or questionnaires. Essentially, if your question is pertinent to the area of interest, you're pretty much free within ethical considerations to be able to do what you want to be able to do. So from a structure perspective, as we said, we run in semesters. And at level 4, you don't do a placement. So you have those 2 long and thin modules, and those are supplemented by each block of the semester, a 6-week module that runs and is done and dusted. When you move on to your second years or at level 5, things change up a little bit to accommodate clinical placement. So at levels 4 and 5, so at levels 5 and 6, or second and third years, everything works in 6-week blocks. So you are either in a 6-week block of teaching, or you're on a clinical placement. And at level 5, or your second year, 6 weeks in, you go on a placement, and then post-Christmas you're on placement again. So you do a 12-week block of placement separated by Christmas. So this is where you really start to get your clinical mileage up, start to be able to apply the knowledge that you've learned at level 4 in your first semester or your first 6 weeks back on site. So a lot of those modules are run to give you the skills to then be able to apply whilst on placement, and to be able to get the most out of that clinical exposure. When you have that knowledge, seeing it used in the real world is really important. From an assessment perspective, which people are often very interested in, we tend to have a wide range of assessments that's both in terms of being contemporary and trying to move with the times to make the assessments as engaging, and from our perspective as real world as possible. So the assessments are generally all chosen through virtue of them being the best modes for assessing the learning outcomes for the relevant modules. There is a fair bit of practical assessment within it, because it's a largely practical based course. There are very few pure written examinations, which I'm sure most of you would be quite pleased with. There's a reasonable amount of coursework, so essay writing and portfolio-based stuff. So when you're on placement, you produce a portfolio that tracks your placement and learning journey throughout that. So I think if you don't consider yourself a good writer, there's ample amounts of practical assessment to help you still be able to achieve a good grade on that front. And if you're very much written driven, I think that sort of balances it out. For those candidates who don't consider themselves good writers, the university has some fantastic support around, in terms of learning advisors that work one-to-one with students, giving them strategies, setting them tasks, giving them guidance on how to read deeply, assimilate that that evidence or that literature, and how to be able to write in a better way. So I think the university are very good at supporting students through their journeys. You're not just left hanging. And to that end, we have a personal tutor system. So at the start of level 4, you were assigned to members of the teaching team as a personal tutor, and they will touch base with you regularly throughout the year, and you're obviously free to communicate with them at any point for any sort of pastoral needs. So if it's just for a chat, you're not sure about something, or you're struggling with something, your personal tutor is a good point of call, as someone who can signpost the relevant support that may be pertinent to you, and also to help sort of advise you on academic matters in terms of how to manage your time, how to structure your learning, how's best to revise for something. That personal tutor system works quite well. So my advice would be that if you find that you have sort of things that you would perceive as inherent weaknesses or areas for development, make sure you engage with the support that's available, because the university are well set up for helping to support students through their learning journeys. So BASRAT, as I said, is our professional regulating body. So we are or were the first BASRAT accredited institution in the UK. And BASRAT are really important. So they are what the CSP to physiotherapy would be. They're the regulating body, and that means they regulate both our graduates. So in terms of professional conduct, behavior, BASRAT are the accrediting body that oversees that. But importantly for you guys as prospective students is that they also quality assure all accredited institutions. So things like staffing, so the staff student ratio, BASRAT have strict guidelines that are set, and the university have to meet these guidelines in order to remain accredited. So that really helps ensure that we deliver the best service possible, that we're appropriately staffed, we have appropriate equipment to deliver the course, and that your assessments and the content taught within the program meet the BASRAT educational framework. So if you've looked at several BASRAT accredited institutions, you may notice there are subtle nuances to what are taught within the courses. Some universities have a greater focus on certain areas than others, but the core framework has to match the BASRAT sort of educational guidelines. So at the center of it all those institutions will teach the same thing. Some just maybe in their areas will have specialities that they'll better prepare their students for that niche. As far as St. Mary's go, I think we produce a very broad student with skills that are suitable for any sort of sporting musculoskeletal environment. So from a placement perspective, we have a very wide array of placements ranging from elite sport to grassroots sport. We like to try and give students a blended placement experience. So you get an opportunity to request the nature of the placement that you would like. We can't always guarantee that we will give you the exact placement that you would like, but at some point on any of the 4 placement blocks that you will have, we could pretty much guarantee you exposure in an environment that you see yourself fit to. We obviously encourage students to try as many different placement exposures as possible. There are many students who start the program thinking that they would definitely want to work in professional rugby or professional football, and then having had exposure to a different environment find that they prefer that. And some people find that actually when you go behind the scenes, even if it's the sport that you're used to, when you see what happens backroom lifestyle wise, that it's not for them. So regardless of where you see yourselves in the future, we would actively encourage you to get as much exposure to different environments, even if it does confirm that you don't like that environment, then at least you know you've ticked that box and you can firmly put it to bed. So some of our higher end placement opportunities, if you like, we have sort of placement opportunities within professional rugby. So we currently have a relationship with the England 7-a-side team where we have a master's internship currently that is looking to be developed to incorporate some BSc students on an internship type basis for their placement with the England 7-a-side team. We have placements with Premiership and Championship rugby clubs. We have a number of placements at Championship football, semi-professional hockey, and we have some really nice sort of longer, if you like, intense placements that are on offer. So a colleague of mine is an American athletic trainer and has a good relationship with the Philadelphia Phillies. So through the Professional Athletic Trainers Society, we're able to offer placements in the summer. So you have to apply for those roles, and the actual teams themselves make the selection, go through the selection process with you, and will accept you or not, as the case may be. And these are generally run in 4 or 5 week blocks over the summer. It is largely self-funded by yourselves, but the benefit of this is that it allows you to clock up a huge number of placement hours in the summer. And although we still encourage you to go on your other placements, you don't necessarily need to get the number of hours that you would ordinarily be able to, or you would ordinarily have to get. So it allows you to be able to do perhaps multiple elective placements. So rather than going on a 6-week placement block, you could do a couple of days here and there in different environments to really get an idea of the areas that you might be interested in or not. Many of these placement opportunities serve well in terms of formulating sort of networks, professional networks. Many of them do, from time to time, when their staff turnover dictates, they will very often offer up internships, which more often than not lead to postgraduate employment. So being on clinical placement is a hugely important opportunity to show yourself off in the best light, whether that be for your clinical placement supervisor to provide you with a good reference, or I guess help you grow a professional network. But also if you show yourself in a good light whilst on placement, it would really help get your foot in the door with regards to an internship. And obviously if you impress in those sorts of environments, then they would be more likely to employ you. Quite often in professional sport, they like to try before they buy. So rather than just appointing someone off the back of an interview, if you've done an internship with them and they know how you fit within their team and backroom staff, that they tend to prefer that as a way of recruiting people. So we have plenty of opportunities for our candidates, and have that exposure across those placement experiences. So from a career option perspective, I think the course has a wide array of skills that are suited to working in a musculoskeletal injury treatment rehabilitation setting, but also many of those skills are very readily transferable to multiple different postgraduate roles or postgraduate studies. So lots of our students do go to work within sports clubs. Some students leave and set up independent clinics, either as rehabilitation therapists or going down more the soft tissue therapy route. Some of our students go on to work within the NHS. So we have students that are specialist rehabilitation instructors within NHS services. Some of the modules we teach have areas of specialist interest, sort of along the lines of pain, neurological injury, and we have a few students who have found themselves working in specialist centres for patients with neurological injuries, which is not necessarily specifically what sport rehab is about, but there's enough exposure there that when they require exercise therapy, graduate sport rehabilitators are well placed to work within those environments. We also have students who go on to work within the military. So for those of you who are unaware, as a civilian, the military take on what they call exercise remedial instructors, and they can be based anywhere around the country. So as a civilian, you can seek employment within the military which is tremendously diverse in terms of the array of injuries that you might see in soldiers. If you're interested in that, my advice would be to get Hep B vaccinated whilst you are a student, because that's a prerequisite for the military. And often when those jobs come up, because it takes quite a while to go through your Hep B vaccination protocol, you can miss out on those opportunities. So if that's somewhere where you see yourself working, or in fact within elite sport, it's well worth getting your Hep B vaccinations up whilst you're still a student. And some of our students beyond work go on to postgraduate studies. So again, some of the modules within the program will expose candidates to areas that they may not have considered to be of interest, or they may just not have had prior exposure to that, so didn't even know it existed. So we have students who go on to do masters in physiology, we have masters in psychology, strength and conditioning, and we of course have students that go on to do masters in physiotherapy as well. So I think again the course gives candidates that exposure, and very often if students had applied for certain programs from an undergraduate perspective and were unsuccessful attaining at least a 2-1 degree from St. Mary's, and I guess the competencies you address within the program set students up very well for gaining postgraduate courses. So that's something to bear in mind for some of you as well. For those of you who want to know a little bit more and haven't done so yet, visiting the web site and following links for sport rehabilitation will tell you a little bit more about the specific modules covered on the course, for those of you who are more interested in getting down to the nitty-gritty of it. And obviously you'll have the opportunity to ask some questions today. Which brings me nicely on to question time. So I probably should have said earlier, shouldn't I? For those of you who have questions, the question and answers tab is where you can type out your questions, and I will endeavour to answer them. Again, probably should have said earlier, but I have a colleague of mine, Jen Benson, with me, who for questions that are not necessarily specific to the course and course content may be able to help with some pertinent questions that fall outside of the course content side of things. So for the attendees, I have a question that says, as a practical hands-on course, in light of the current pandemic, how do you envisage the next academic year being delivered with the restrictions that might be in place? Full marks and a bonus point for hitting the pertinent question on the head. At the moment, we are planning very intensively for a multitude of different scenarios. So we are hoping that come September, that we will be able to deliver all our theory content remotely in order to mitigate the risks and abide by government guidelines. But we're hoping to also supplement this with face-to-face practical teaching. So as an industry, or as a higher education landscape, more and more content is started to move to be delivered online to save students from having to travel, manage work around their studies, etc. So we would hope that it wouldn't be too different to the normal student experience, and that we can still remain safe and be able to give candidates the best hands-on experience. So we are, again, very lucky to have a fantastic teaching and learning or technology and enhanced learning team. And we are well equipped with the software and resources in order to be able to run things remotely. But at the moment, if everything goes according to plan, we will be starting in a blended manner, which would largely be theory taught online, practical content taught face-to-face in small groups that meet the government guidelines with appropriate PPE, etc. Our level fours, obviously the transition between school and higher education is quite a big one anyway, and we're fully aware of that. So the current pandemic makes that a little bit more of a challenge, but accordingly, we will prioritize the amount of face-to-face exposure in a safe environment in order to support our starters as best possible. I hope that answers the question. If there's anything more specific, feel free to let us know. I have another question that is, what is the difference between sports rehab and sports therapy? Largely, the differences lie in some of the specific content. So both courses essentially are pro-exercise in terms of how we would manage things. I think sport rehab has probably a greater amount of sort of academically driven content relative to sports therapy. Now that may be a sweeping generalization, but if you do some homework about sports therapy is a course that could either be a proper 3-year full-time degree program, or there are sort of sports therapy courses that are done in a 2-year period that aren't necessarily full-time, and they would still come out with being a sports therapist. So I think the biggest divide between sport rehab and sports therapy is that anybody who calls themselves a graduate sports rehabilitator has undergone a 3-year full-time degree, whereas in sports therapy, that isn't necessarily the case. Although there are some institutions that sports therapy degrees have chosen to become accredited to BASRAT rather than the Sports Therapy Society, which is an indication of them trying to show that their programs are a full-time degree program. But essentially, the programs look to do the same thing. They're both centered around exercise prescription in treating people who have musculoskeletal injury. I hope that helps. It's hard to, I obviously believe sport rehab is better through virtue of what I've done, but I think without saying anything that would be inappropriate, I think the way I would look at it as is, sport rehab is definitely a 3-year degree program, where sports therapy isn't necessarily the case. Another question is the course content likely to change for September? So no, not at all. So the content that will be delivered will be exactly the same. That's part because of our accrediting body. So we have to teach certain content in order to maintain our registration or our accreditation. But as previously stated, how that would be delivered may alter. So again, that's largely going to be dictated by government guidelines. So if we had our way, we would do it all face-to-face. But that's not sort of our decision to make. For what it's worth, when the pandemic hit, St. Mary's were really proactive in terms of making taking control really. So rather than waiting for the government to announce that everything was going to be locked down, the university decided to take control of that. And essentially we had 3 days notice, and then everything went online, and our whole back end of last semester was delivered online. We managed to get all our level 6 students through their courses, and I think we've done that really successfully off the back of not having much opportunity to create content to be delivered online. We are now in a position where we hope to be back on site for staff on the 20th July, and we have between then and September to be able to create sort of videos and online content to help facilitate learning, so that we can take we can make the best advantage of the time we have on the practical front. So at level 4, all I would say the difference would be is your key bits of theory will be delivered online. Some of that would have possibly been delivered online anyway, and then that will be facilitated by practical work. Online, for those of you who may not be aware of what is available, isn't purely reading a PowerPoint presentation online. The university has some fantastic software that will allow us to deliver a video lecture with a PowerPoint presentation, with polls, interactive questions, etc. within that resource. We have chat rooms at our disposal to follow on from that, to test that students have engaged with that material. We make use of Zoom for seminars, for group work, etc. So don't think of online as just having a document posted that you have to read through. It's far greater than that. And I would think as a level 4, that would be the biggest change, is having to engage well with that, because if you haven't engaged with any of the online material, it'll make it a lot harder to get the most out of those practical components. So a lot of the online content will be, if you like, a prerequisite to have engaged with, so that then you've got a basis or a foundation for where the practical components would come from. But the pattern as it stands, which is yet to be set in stone based on uncertainty in government guidelines, will generally follow a bit of online content a week, followed by some practical content within that week. So you will be on site and face to face on a weekly basis, perhaps following the first week or so, where a lot of it will be done online, but based on government guidelines more than through what we would want. I hope that adequately answers your question without waffling too much. A question from Rob saying, I have been offered a place at St. Mary's to study sports science with S&C. Can I change over to study this course? As far as I'm aware of it, there's no reason why you couldn't, as long as you have the relevant prerequisites for the course. Perhaps Jen will be able to type an answer to tell you how you could go about that. But alternatively, if you go onto the St. Mary's website, my email address should be readily available. If Jen doesn't kindly type that for you, I will be able to follow that up on that. Not tomorrow because we're interviewing all day, but I will be able to, within the next 48 hours, follow up on that and give you information about how you might be able to do that, if that's in fact what you want to do. Another question says, are sports rehabilitators able to work pitchside or just behind the scenes? So sports rehab is absolutely are able to work pitchside. So part of our professional accrediting body's criteria is that for the last 4 years, BASRAT have stipulated that all our graduates have to have done the FISIS level 2 course. So for those of you who have a bit more knowledge of the sporting environment, the RFU run a program called the Pre-Hospital Immediate Care in Sport course. So it's the program that's mandatory for you to have attained in order to be able to work in professional rugby. So there are 2 levels, a level 2 and a level 3. So a level 3 course involves doing surgical airways, etc. That's not the course that you would have through St. Mary's, but level 2 course is a level which is the minimum standard. So for those countries where money is an object, they have to have at least FISIS level 2 to be able to stand pitchside at Twickenham. As part of your program and paid for by the university to meet BASRAT guidelines, we run the FISIS level 2 program in-house. So you get pitchside first response stuff taught embedded within the program, but that doesn't give you that accreditation. But when you get to the end of your 2nd year, and certainly within your 3rd year, in the summer and in September, we generally run 3 courses a year where you can attend the FISIS course, where you're given pre-course reading like you would if you did it as an external candidate. You're taught on site and assessed, and after that you're given a certificate should you pass the course. It's an external course, so it's beyond the university's control as to whether if you're successful or not. You get re-attempts at it if you're not successful on the first attempt, but that is an external professional qualification that equips you to stand pitchside. The caveat in that is until you are a graduate, although you have that standalone qualification, you're not insured to work and get paid to be a pitchside therapist. But upon graduation, where you have the insurance, then that course will allow you to stand pitchside at any level. And absolutely, part of my role in professional rugby was the head of sports and exercise medicine for a championship rugby club, and yes, I did the pitchside work in that capacity. So absolutely. And BASRAT's kind of, I guess, romantic idea behind making the FISIS course a prerequisite for our graduates has borne fruit. So again, if you look at UK sport jobs, jobs in sport, various clubs, a lot of clubs, certainly those at better levels, will have prerequisites like having FISIS level 2 as a minimum requirement for applying for those jobs. So I think that's made a big difference. Our students or graduates leaving with that accreditation has made a big difference in terms of their employment opportunities. You're probably getting a theme here that I struggle to answer things too concisely. Is the Performance Education Centre available to train in when the strength and conditioning students are not using it? So yeah, so sounds like you know a little bit more about the workings of things. So essentially the Performance Education Centre is called that because its primary role, in spite of being the amazing training facility that it is centered around education. So teaching is its primary use, and we have turned away international rugby teams from using it during the day because that clashes when it's supposed to be used for teaching. So it's only ever used as a pure training facility outside of that teaching. The PEC is timetabled, so there are regular slots that that are scheduled for non-teaching activities throughout the day, where students can do practice training, if you like, for their relevant modules, and you can join as a student member to be able to use the PEC facility of the evening as a kind of gym membership if you like, but not that I'm saying it, but a lot of students, the S&C students, rehab students, because there is a requirement within their courses to practice lifts, to be familiar with coaching and how to do that in taught sessions. The facility is free to use at regular slots, free of charge for students, under the guise that they're familiarizing themselves with training. So what I'm getting at is no one's going to call you on that for doing a proper training session, because during those times that training has something to do with you learning about lifting for your course. If you wanted to use it of an evening on a regular basis, then you would probably need to pay for a gym membership, but it's not exclusively for the strength and conditioning students. And in fact, the sport rehab program is probably bigger than the strength and conditioning program, and probably use the facility, ironically, probably more often than the strength and conditioning students do. But yeah, if you're into training, there's certainly capacity to be able to do so. Are there any more questions? By all board, you're still all online. Speak now or forever hold your peace. So other questions come through saying, are you assigned a personal tutor on the foundation year? Are you talking about the foundation year as in doing the foundation program, or do you mean your first year? I guess on both fronts, without overcomplicating it, yes, you are. On both fronts, I believe on the foundation program, though, that obviously there are fewer teaching staff, so there are more students assigned to an individual. Yes, so yes, you are assigned a personal tutor. It's just there are fewer tutors, so they have more students, but your exposure is just the same as if you were on the level 4 of the undergraduate sport rehabilitation program. Very much the same services are at your disposal as far as the support goes. So you have access to our faculty learning support advisors who work very closely with students in terms of developing their academic skills, if you like. So it goes beyond writing. We use them largely for writing, but from a foundation year perspective, they help you with all sorts of things to equip you with the skills required to start the undergraduate degree. We currently, I think, I have 2 students in the first year cohort that's just made their way through, who came from the foundation program, and they're doing very well. I think that the foundation year, for students who come from all sorts of different educational backgrounds, really works well to equip our students with the skills that they require to embark upon a degree program. Very often when they start, they like to feel like they're ahead of the game, because having gone through the foundation year, You will be familiar with our virtual learning environment, Moodle, and how to access modules, the links that you have to submit your work to, how learning sort of resources are, I guess, delivered to students, which might be very different if you've done an A-level program. You may not have had that kind of exposure. So yeah, in a long way, yes, you will have a personal tutor assigned to you in the foundation year, yes. Any more for any more? So we've lost one, but no questions coming through. Just out of interest for the participants are still online, how many of you, or if you just say start September or 2021 start, just so we've got an idea of who's looking at coming imminently versus in the future. And confirm you're still with us. I'll buy you a coffee, Ben, when I see you. So please, guys, this is an opportunity to ask questions if you have them. You're very welcome, Ben. We look forward to meeting you. If there's something to take home from this, I think everything you will read and see about St. Mary's would give you the impression that it's a kind of small, tight-knit community. And I can say from first-hand experience, St. Mary's is just that. I think it gives you the benefit of being in that small kind of community type environment, but with a big world around you. So it's not so insular where it kind of restricts you, but it definitely has a nice kind of friendly community feel to it. Within the program, students, make lifelong friends, and it's a really nice kind of environment to be in. And for you guys who are looking at starting this September, like I said before, what we were able to do with such short notice, based on the resources that we have at our disposal, I think was testament to the team, but testament to how St. Mary's as an institution invest in the sort of technology enhanced learning, software, equipment, etc., in order to facilitate an optimal learning experience. And without that, we just couldn't have done what we've managed to do. And although things are different, everything's different in this current environment. And I feel very confident that with what we have at our disposal, with a team of very enthusiastic, passionate people who are really passionate about, I guess, teaching people about the profession, because I think none of us have turned to teaching because we weren't successful in a clinical world. Most of us still maintain that clinical world, but it's because we feel passionate about sort of teaching other people about that world. I think we're very well equipped to be able to cope with whatever the landscape would look like based on the COVID pandemic. We are obviously very much at the mercy of government guidelines, which we will adhere to stringently in order to make sure that staff and students are safe. But within the goalposts that are presented to us, we will deliver the best learning experience possible to you guys.